You go to the drugstore and you might be looking for aspirin, ibuprofen, maybe over-the-counter pain relievers. But what's the difference between all of these? What do you need to know about them to be safe? We asked insider Dr. Jose llach, and here's what he had to say. For minor illnesses, aches and pains and discomfort, there's a number of different over-the-counter drugs that can help, but these aren't always taken safely, right, doctor? I mean, some people can abuse of them. You see parents saying, oh, can I give my daughter Tylenol, then ibuprofen, and it's every this. People sometimes over-abuse of it.
Yes. Actually, that's one of the things as me as an ER physician that I really worry about in educating our patients before they go home. One of the things that I always chime in with my patients is the things to look for and what to do when that occurs. In other words, should I take Tylenol? Should I take Motrin? Or what should I take when you're getting sick, and at what kind of dose should you take it versus not take it? And like you're saying before, read the label, because you get a lot of good information by reading the label. So one of the things that I always tell my patients is if you have like a fever, you always want to alternate between Tylenol and Motrin.
That's what I've heard.
Exactly, yeah.
And it's like almost every 3 to 4 hours?
Every 3 hours, yes, good point. So one of the things that I do is you do like a clock. You have 12 o'clock and 6 o'clock, 3 o'clock and 9 o'clock. So what you could do is between 12 and 6, which is a 6-hour difference between, you could do your Tylenols. So your Tylenols could be at 12 and 6. And Motrins or your Advils at 3 and 9. So that's another nice little clock type educational system that I use for my patients.
And that Tylenol, of course, is the acetaminophen, right?
Yes.
All right, and there's different types of acetaminophen.
Yes.
But acetaminophen is good for?
For fever, for aches, for pains, and all that. The only thing is that acetaminophen is not an anti-inflammatory, but it is good for headaches and whatnot.
And the anti-inflammatory would be the ibuprofen?
Yes, the ibuprofen, the Aleve, the Advil, those are your anti-inflammatories, yes.
What about aspirin? How is this medication different from those two?
That's a great question. People are like, what exactly, I took aspirin. To be quite honest, aspirin has all those types of mechanisms, meaning it's good for the fever, it's good for the inflammation. But the only thing about aspirin that kind of worries me a little bit, that increases your chance of bleeding. Because what happens is that your platelets come together to form a clot. This aspirin will prevent these platelets to come together so you do not form a clot. Thus, if you don't form a clot, you have an increased chance of bleeding.
Interesting, I didn't know that. Okay, the Food and Drug Administration, by the way, recommends taking no more than 4,000 milligrams of acetaminophen in a 24-hour period. What kind of damage can too much of this drug do, doctor?
That's a great question. It's something that actually, one of the cases that I had in the winter, flu season, a few years ago when I trained in Philadelphia, I had a lady, I remember coming in, and she actually comes in for fevers, chills, flu-type symptoms. But then the one question that I always ask as an ear physician is, how much Tylenol did you take in the last 24 hours? This lady told me she had taken about 10 pills for the last 4 days.
Oh my.
10 pills. So what happens is that one of the things I had to do, I'm like, okay, let me make sure that, let me make sure that her liver is okay, because Tylenol could affect the liver and actually cause what's called necrosis in the liver.
Right, I mean, it's on overdrive at this point.
It's on overdrive, exactly. And what happens is that, liver injuries or liver damage can be very dangerous for the patients, because what happens, they can bleed when you have liver type problems. So the one thing I always ask my patients is, how much Tylenol did you take? And my magic number is 8. Always remember that. You always want to take less than 8.
In a 24-hour period.
In a 24-hour period.
Okay, now here are some tips from the FDA about how to take acetaminophen safely. Take a look.
If you're like me, being active and staying healthy are important, but sore muscles sometimes get in the way. If you take medicine for minor aches and pains, you should know it may contain acetaminophen, an active ingredient found in hundreds of over-the-counter and prescription medicines that treats mild pain and fever. When used as directed, it's safe and effective. Over-the-counter medicines you buy off the shelf, like some cough and cold medicine, flu remedies, pain relievers and fever reducers, and even some allergy medicines and sleep aids may contain acetaminophen. This is important to know because taking more acetaminophen than recommended for one day can cause serious problems. And it's easy to do by mistake since acetaminophen is in so many different medicines. For example, suppose you're taking medicine for a cough or a cold and taking another prescription or over-the-counter medicine for pain. Both may contain acetaminophen, and you can get too much. This can lead to serious liver problems. You don't want to take more than one medicine containing acetaminophen without first talking to your doctor, nurse, or pharmacist. To be sure you don't take too much, look for acetaminophen on the over-the-counter medicine labels. It will be listed on the front of the package and on the drug packs label. Look for acetaminophen on the labels of prescription pain relievers, too. It might be completely spelled out, or the label might have a shortened version, such as APAP or APAP. If you can't tell what's in your medicines, or if you have questions, ask your pharmacist, doctor, or nurse. Keeping these tips in mind not only makes sense, but can also help keep you healthy and in the game.
Another over-the-counter medication that I want to hone in on, because it's one that a lot of women tend to go to the pharmacy immediately,
Yes.
or CVS or Walgreens, is Urostat, and is it Azo or Azo?
Azo,
It's
yes.
Azo, and that's for treating a UTI, urinary tract infection. Can you explain what these are, and is that another one that you can maybe over-abuse on?
That's a good question. Actually, one of the key things about Azo is you could take it, but definitely take it, but find out the reason why you're taking it. Because you're having usually people who take it, especially women, like we were talking about earlier, is in the break, is that it basically treats the symptoms of a urinary tract infection, meaning it takes away the pain of when you urinate. But what happens is that you might take the symptoms away, but the big but, that's the big situation. However, is that you do not take care of basically the infection. Right. So what happens is that this is the kicker to it. What happens is that this urinary tract infection can actually extend into the kidneys, and it goes into your system, and then you basically become septic, or basically become a really, really bad infection.
Right, because it's kind of masking the fact that...
It is masking the effect, yes.
And that could be dangerous. If you go into septic, then what? Then you have to go to the ER at that point.
Then you have to go to the ER, exactly. Whenever you have a urinary tract infection or signs and symptoms of a urinary tract infection, just go to urgent care. Go to Express Care with Baptist. Go to the ER if need be. Or just call your doctor, and he will call in some antibiotics that will treat this infection that you have.
And if you want to learn more about how to safely take over-the-counter medications, we have some great tips for you. Just go to our website, allhealthtv.com, or if you have a question, you can always call us. It's so easy, 855-796-4475.